Well, the Obamacare debate hitting college campuses. Cornell University students will be soon saddled with an extra $350 penalty fee for having their own private insurance. If they decide that they don't want the university's program, that's the fee they'll have to pay. So outraged students storm the university president's office in protest. Watch.
You've mentioned, throughout this conversation that you empathize with us, you understand, and you want to do something about it. But we don't just want you to empathize with us. We actually want you to do something about it.
Editor-in-chief of the Cornell Review, Casey Bresnick, shot that video, and he joins us now. What was it like in that office?
I wasn't actually in the office. I was in the hallway because they had some bodyguards guarding, preventing any more students from entering the office.
What did the school president say?
Basically, that was actually a 40-minute confrontation between about 20 to 30 students, angry students, mostly the liberal left-wing students, and the university president. And basically, he heard all their grievances, everything they had to say, and not only were they just criticizing him for the fee, but then they just laid basically every single grievance under the sun that they have against him.
So explain this fee. Why are these kids so outraged?
Right. So last week, Thursday, President Scorton of the university sent an email to all students basically explaining there's this $350 fee, the student health fee, that's going to be levied on all students who do not purchase SHIP, which is Cornell's student health insurance plan. So basically that'll affect about 70% undergrads. And the fee is just going to pay for expansion of health services and also to help pay back debt that Cornell has that it took out to pay for the expansion of health services. And of course students erupted, outroar, outrage because another cost to go to Cornell is a fee, so financial aid won't cover it.
Right, and tuition increases about 4%. Right. So they're making a lot of money. Cornell's not cheap. They're making a lot of money. These students are outraged, these liberal students are outraged, and yet these are the very students who the Obama administration reached out to spread the message about Obamacare. Do you see some hypocrisy here?
Yeah, that was one of my immediate reaction on the second I finished reading that email was, this plan, the SHIP plus fee arrangement is basically just like the Obamacare arrangement, because in brief, Obamacare is if you don't have health insurance, you have to pay this tax to the government. And at Cornell is if you have private insurance and you don't want to buy Cornell's insurance, you have to pay this $350 fee. And these same students, as you just said, who vote, Democrat Party line, who support these big government progressive policies, when it finally comes down to their pocketbooks or their wallets or their families' wallets, they're all of a sudden in outroar. They're occupying the administrators' buildings, taunting and screaming at the president.
Yeah, storming into the president's office. Well, here's a statement from Cornell. I want to read it and get your response. Cornell has written about this. They say it's our responsibility to work together to make sure everyone in our community who needs help gets it. That's a burden and benefit we all share. What do you make of that?
Well, I mean, yes, obviously, if there are people sick on campus, they should get health care, because back in 2009, 2010, one of the reasons why the cost went up is because there were 1,500 cases of H1N1 virus at Cornell, and that's why they increased staffing. But I think there are 2 points here. One, it's kind of this flawed philosophy that you need to redistribute wealth from some families or some students to pay for others, and that's what they initially tried to sell it as. And the second point, which Cornell doesn't admit in that press statement, is that $70 out of this $350 fee is going to pay back debt that Cornell took out to pay for the student health center. So students are effectively not only having their wealth redistributed, they're also bailing out the administration.
Unbelievable. Thanks so much for joining us.
All right, thank you so much.
Appreciate it. Thanks.